Hello everyone, this is Nurse B with Buzzing with the Bee. Today we are going to talk about a disease that has spread rapidly across the world over the last year, creating a pandemic. This is SARS-CoV-2, or what we know as the coronavirus. As soon as you become exposed to the virus, your body and the virus are in a race. And the race determines whether you will live or whether you will die. Some people's immune system is great, and they may not get the coronavirus infection. The people who do not have as good as immune system are usually the older people because they have underlying health problems like diabetes, hypertension, chronic obstructive pulmonary diseases, cancers, those types of things that weaken the immune system. So their response to the virus may not be as quick as a person who is healthy. That is why younger people may get the virus but do not have any symptoms or asymptomatic because they are healthy and their immune system is charged up. Okay? Kids are fairly healthy too. So when they are exposed to the virus, many of them never get any symptoms. The people most likely to get symptoms are people with underlying chronic diseases. So if you are a person with an underlying health problem, you need to be doing something right now to help you to prevent yourself from contracting the disease. The best defense is prevention. So let's talk about what you can do to protect yourself and your family. First, to protect yourself, you need to practice 4 things. Those 4 things include wash your hands with soap and water. If you do not have soap and water and no visible residue on your hands, you can use a hand sanitizer. Okay? Wash your hands frequently anytime you come in contact with surfaces. Shake people's hands, touch doorknobs, go in and out buildings, get in your car coming home. You need to wash your hands. The next thing you need to do is, if you're sneezing, cover your mouth with some type of tissue. People who are coughing and sneezing around you, you need to remove yourself from them, but please cover your mouth. The other thing you need to do is simply wear a face mask. The face mask will help contain your virus to you, so that if you cough or sneeze, you don't spew the virus out into the public and into the air around you. And the other thing you can do is practice social distancing. 6 feet. For many people, that's a little more than your arm span. Okay? So if you take 3 giant steps, that's 6 feet. The next thing you need to do is to protect your home and family by starting with knowing the symptoms of the coronavirus. Feelings of malaise, weakness, tiredness, loss of the sense of smell or taste, body aches and pains. You may start sniffling and coughing. It can progress to a deep hacking cough, fever. The day of monitoring your fever by just saying, I have a fever, no, you can't do that anymore. You need to buy you a thermometer. There are electronic thermometers for about $5. And then, of course, if you don't want to contact, you can have no contact thermometers, and they cost around $70, less than $100. The other thing you need to watch out for is if you have trouble breathing or having cyanosis or bluish color to your skin. Those 3 are indicators that you really need to go to the emergency room. If you have a hacking cough, you can't catch your breath, you have shortness of breath, you turn blue, or you have a high fever, you need to go to the emergency room. When you first start experiencing the symptoms, you need to call your doctor's office, and they will give you directions about what to do. They will most likely tell you to go to some type of coronavirus testing site before you come into the office, because they don't want you to infect people who are sitting there waiting for them. The other thing you can do is you need to limit the number of people who come into your house. No people who are sick should be allowed in your house. You can ask people who come in your house to wash their hands and put on a mask. Okay? You can have masks available. If they don't want to do it, then they don't have to come to your house. It's your house. The other thing you can do is clean surfaces with some bleach and water, or some type of sanitizing wipes. It's a bleach and water solution. You mix the bleach, a third cup of bleach to a gallon of water, and then you can put it into this container, and you need to clean surfaces with soap and water. That's like the tables, the counters, the doorknobs, things like that that people touch. Then follow up with a cleansing solution like bleaching water or some type of alcohol-based wipe. Sometimes if I don't have any alcohol-based wipe, I just use the sanitizer and put it on a paper towel and actually clean the surface with it. All your sanitizers should be at least 70% alcohol in them. Okay, that's very important. It's at least 70% alcohol. The next group of people who we need to protect are our coworkers or the school children that your children go to school with. First thing you need to do is teach your children and yourself to wash your hands. Also, take your temperature before you leave each day. If you have a fever, don't go to work. Don't send your kids into school. Practice social distancing when you're at work. Wear a mask when you're at work. But the main thing is that you need to take your temperature and monitor yourself every day before you go to work or send your children to school, so that if you have any symptoms, you can make the decision not to go to work and call in. If you do contract the virus, you need to protect the people that live in your house. So what you need to do is isolate. You need to isolate yourself for 10 to 14 days. Hopefully you can have a room that has a bathroom, and no one should come into that room. If they bring you food, they should bring it to the door, but not go in there with you. You're going to be bored, so have some things in there that you can do to help you with getting through the day. Monitor yourself for worsening symptoms. If you feel that your symptoms are getting worse, you need to call your doctor or notify somebody in your family. Make sure that you continue to wash your hands frequently. Cover your mouth when you cough or sneeze. No sharing of personal items. And clean all surfaces in your room on a daily basis or more often, because the coronavirus can sit on surfaces for several hours. So please take care of yourself so that you can be as healthy as you can be. And thank you for joining with me, Nurse B, on Buzzing with the Bee.